Hi, I'm Dr. Kate Kresge, a naturopathic doctor and a huge fan of the Redefining Medicine podcast. Like you, I tune in to get inspired by the visionaries who are moving whole person care forward. Whole person care takes a whole lot of work, and staying inspired is half the battle. The other half? Finding the right partners to support your practice. That's where FullScript comes in. FullScript helps you capture patient data, dispense supplements, order lab testing, and keep your patients on track, all in a single platform that's completely free. FullScript helps you streamline your workflow, grow your practice, and deliver whole person care at scale. And with FullScript's acquisition of Rupa Health, you'll have access to even more lab tests on top of the 1,000 already on the platform. I can think of 100 reasons to join FullScript, and you can read more about them at fullscript.com/A4M. Now, back to the podcast.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, we're here in Chicago at A4M's Cognition 360. It's all about the brain. It's a really great conference, and I have the pleasure of having Dr. Austin Perlmutter with me. Now, Dr. Austin Perlmutter has a great family history, since everybody knows the Perlmutters, but I don't want to take too much away from him, so you are an expert in brain. You're doing research. You're doing an amazing job. You did a great job on your lecture. So make it small about the family, but go ahead, tell me. It's such a pleasure to see you. Next generation.
Thanks for having me. I'm excited about this conversation. I have spent a considerable portion of my life being around people who care a lot about the brain. So my father is a neurologist, a functional medicine neurologist. He's been obsessed with it for a long time. But what some people don't know is his father was a neurosurgeon. So it's kind of been a family tradition of caring a lot about brain health. The thing for me was I didn't necessarily know that I wanted to go in this direction at all. And I was planning to be a young adult fiction writer until I decided to make a career pivot and going to med school. And even then, as an internal medicine doctor, I wasn't quite sure what I wanted to do. So it took a couple of factors coming together for me to recognize that the brain is where I wanted to focus my attention. Those two things were, one, my dad's dad, a neurosurgeon, a brilliant guy, one of the top surgeons in all of Florida, and specifically at the time, one of the only neurosurgeons in all of South Florida, developed Alzheimer's disease and then eventually died from Alzheimer's disease. So I was watching his cognitive decline as a medical student and recognizing the significance of what happens when people lose their cognitive abilities. And then the other variable was in working with people in clinical care and seeing how all of these different issues, from hypertension to dyslipidemia, really all centered around understanding how people make decisions and what it is they care about. I recognized that it was all about the brain. So I became fascinated by this question of trying to understand how we make decisions, for the better or for the worse, because whatever the case may be, we know that our actions each day are the principal driver of our health outcomes. And so as an internal medicine doctor, I was focused on stages of change, on motivational interviewing, on trying to find ways to get people excited about making these changes in their lives so that they could eat healthier, exercise. And I wanted to take it one step upstream to understand what was happening in their brains that would allow them to make good decisions or not good decisions. What I uncovered is this relatively nascent field of what's called neuroeconomics or behavioral economics applied to medicine, which sounds complicated, but is really the idea that when we leverage lifestyle medicine, we can fundamentally alter the architecture of our decision-making machine, which is our brain. And by doing so, we can prevent not only brain issues, but all health issues that are related to lifestyle. So that led to writing a book with my father called Brainwash, and it's led to doing research on trying to dismantle and uncover all of these drivers that bias our brains towards patterns of decision making, whether it's neurometabolic compromise, neuroimmune or neuroinflammatory issues, and then how does that relate to various environmental factors that we can modulate, and in doing so, give patients and ourselves a better chance at making healthy decisions and therefore promote overall better quality of life.
Well, this is amazing, obviously. And the way you said it I have no room to say anything really. But this is really interesting, and I have to tell you, I do think it has something to do with your genetics, though.
There you go.
I feel like there is some genetic factor here, and everybody who knows me knows that I don't really believe a lot in the genetic factors, but I think maybe it's also environmental because of who you were raised with. So that's an interesting thing. So now you're doing research. So talk to me about how you think that we should be proceeding and what are the changes that are necessary, because I think a lot of our viewers are looking desperately to put together the puzzle.
Yeah, I think all of us are. And I think that's not just doctors and medical practitioners.
Right.
Everyone is trying to put together this puzzle, which is this question of why, despite having all this information, despite living in this beautiful modern age, are people dying earlier? Are people having more disease?
Right.
And I think it all stems from what's going wrong in the brain, because that is what's driving us towards patterns of decision making.
Right.
So I've had the opportunity to participate in and kind of run some research studies over the last few years. A couple I'll just highlight here. So one is a study that I published back in 2021. It was a review paper looking at the pandemic and looking at depression. And, viewers, listeners, you probably all have your opinions on the pandemic. One of the key things that we found, though, was whether you were concerned about the virus or concerned about lockdown, people were depressed.
Right.
So people who got COVID got depressed. People who didn't have COVID but were stuck in their homes were depressed. And so how is it possible that these two very different things seem to lead to the same pathway? What I talked about in this paper is that we now understand that a significant portion of cases of depression are being driven not by serotonin issues, but rather by neuroinflammation, activation of the brain's immune system, specifically these microglial cells. Mm-hmm. And in the context of inflammation secondary to infection, in the case of an infection with COVID, what we saw and what we continue to see is a ramping up of brain inflammation. And that seems to be a driver of everything from COVID-related depression to brain fog, which, by the way, long COVID is the top cause of brain fog now. We also see that people who were in lockdown, what were they doing? Well, they weren't exercising, they weren't eating healthy, they weren't socially connected, they weren't getting outside. All of these are things that promote inflammation. So again, could that be driving depression because we see inflammation in the body translating to inflammation within the brain? So starting to unravel this question of saying, mental health, we've seen this as kind of a construct of the mind. We'd say, oh, well, I'm feeling this and I don't really know why. Is there a biological basis for it beyond this idea that serotonin is the only villain in the story? And the answer is yes, and the answer seems to be neuroinflammation as a key variable. Then the other subset of research that I've been focused on is trying to understand how food works as medicine and how that then relates to brain health. So I grew up in a family where we've cared very much about the food that we've eaten because, in part, it changes our brains. And so my father, my mom, both of them really focused on eating healthy food, organic whenever possible, to support overall health. And there's this idea that, I guess, started in more integrative and functional medicine circles that has now expanded to the general population, which is food is medicine. That diet influences health, not just because if we don't eat calories, we will die, not just because we don't want to be malnourished because we don't have enough B vitamins, but rather that food can help to prevent and potentially treat various diseases because of what is in our food. And then the question becomes how? How does that actually happen? By and large, what we've seen is that people tend to focus on nutrients in food as very basic components of this food as medicine conversation, and specifically when it comes to non-caloric nutrients, so not fats, carbs, proteins, as well as not micronutrients, we think about things as antioxidants, and we kind of called it a day. But is it possible that the various components of our foods, this 8,000 plus molecules in the family called polyphenols, are able to influence pathways within our bodies and in our brains, and we can start to unravel and understand the mechanism of food as medicine in a very nuanced route. So it no longer becomes this fringe idea of, oh, there's antioxidants in apples and therefore they're healthy and nothing more to say about that. So eat an apple so you don't see the doctor, but rather specific families of these molecules that, yes, have an antioxidant ability, but have immunometabolic and other effects, could be programming our brains and bodies towards health. And so we published a study last November showing that when we took the polyphenols found in a plant called Himalayan tartary buckwheat and gave it to healthy volunteers, we were able to see significant upregulation in a variety of pathways in the body using a relatively advanced set of testing called epigenetic testing, related to pathways that are linked to senescence, which is kind of an aged cell, as well as changes in glial cells and neuron function. And the biggest change we saw was in a pathway called ceramide kinase, which is a key kind of immunometabolic transfer that links to lipid metabolism in our cells. So that's a little bit of a kind of a deep dive into this. I'd also say I've been a little bit more peripherally involved in a study where we're looking at the effects of ayahuasca on the microbiome and epigenetics, which is super interesting because as we examine things that can help our brains to kind of get unstuck, it's notable that when it comes to mental health, psychedelics have some of the most, at least interesting, it's not as large of data as we've seen from other interventions, but certainly some of the biggest effect sizes in terms of reversing and improving mental health issues. And the question again is, why? So it seems like psychedelics may actually act on immunometabolic pathways, the microbiome, epigenetics, and by uncovering some of this, we can start to shed light on these mechanisms that otherwise people would say, oh, well, psychedelics, they alter your state of mind, but beyond that, they're really not all that useful. So kind of the larger construct here to put all of this together is becoming a bit curious about what is actually driving our brains towards the decisions we make, the way that we feel, and then trying to find pathways that we can take from this preclinical and clinical research and make available to clinicians and to the general public, and breaking open this chamber that has historically been the brain. It's a black box and the body is separate, and trying to find out how our environment influences our brains.
Sounds amazing. Like when you're talking about epigenetics, explain to us how the epigenetics is, what it means and how it affects.
Right. So for those who haven't heard of epigenetics before, the basic idea is that we have our DNA, and our DNA is relatively unchanged over our lifespan. Certainly there can be mutation, certainly there can be damage to our DNA, but beyond our basic chromosomes, beyond the 20,000 or so genes that a human has, what may be even more important is the way that those genes are being used. Right. And epigenetics is the study of how marks on top of our DNA change the degree that they are being used. So it's not even an on-off switch, which means this gene is being turned on or off. It's actually a gradient, right? So the degree to which a gene is being used. And epigenetics is so powerful for two reasons. One is it transforms this conversation of nature versus nurture to the appreciation that even the DNA that we have from our parents may not be the end of the story. It's how that DNA is being used, which can be modified by our lifestyle. The other really fascinating component of epigenetics is because of the amount of data that it collects. So in our study, we collected 850,000 data points per person at the start and another 850,000 data points at the end of the study. We're able to use advanced algorithms to take that data and allow it to tell us about things like how their immune cells are doing. What is the makeup of their immune system? What is their metabolism doing? All sorts of markers that otherwise would cost thousands and thousands of dollars to get individually, we can deconvolute or extract from that epigenetic data. So the last thing I'll just say on this is most people may be familiar with epigenetics because of something called an epigenetic age clock and biological aging. Right. And this as a concept is also transforming healthcare because as recently as the 10 years ago when I completed medical school, we learned that basically you age based on the years and number of birthdays that you've had. Some people tend to do better or worse across those years, but the most important thing to say, of course, is this is a 72-year-old female coming in with, congestive heart failure or whatever. The age is the key because it tells us so much about the person. What biological age is doing is it's allowing us to unpack this question of why do different people age at different rates? Right. And it's not just that one person may be able to better weather the years of their lives, but rather at an organ level understanding and a cell level understanding that different organs within our bodies age at different rates. And understanding the rate at which that organ ages tells us a lot more than just saying, you're 72 years old. You may say, I have a 65-year-old brain and a 71-year-old heart and a 62-year-old liver, and that can then tell us about how various treatment modalities may be more or less relevant and your risk for developing organ-specific dysfunction. So how that relates to epigenetics is that epigenetics is currently the best way to interrogate biological age because it tells us the rate at which our full body is aging. These are using age clocks, and it can start to tell us about organ-specific aging. So it's really breaking open this idea of saying, okay, here's how old you are, and maybe you can do some cosmetic stuff, but other than that, there's not much you can do, to saying, starting to get that nuanced level of saying each part of your body is aging at a different rate that can predict your rate of developing, in the case of the brain, something like Alzheimer's. In the case of the liver, that might tell you about your risk for developing metabolic liver disease, and that there are various strategies that we can use to potentially slow the rate of aging of your full body and organ-specific level. So this is really important stuff. We're talking about slowing the rate of aging.
Well, I think it's really important. I'm not cutting you off. You have to end, though. But I think it's hugely important because we're so used to, in conventional medicine, just putting people on buckets, 72-year-old bucket, 60-year-old bucket. Here, we're demonstrating how those buckets don't work and how we can correct and improve life and the quality of life by knowing their epigenetic clocks. Thank you so much.
Yeah,
Such a pleasure.